Hi, I'm Dr. Utkarsh. Mouth ulcer is one of the most irritating thing or most painful thing a patient can experience. Any break in the continuity of the mucosa is called as or termed as an ulcer. So this ulcer, whenever you eat, whenever you drink water, every time you move your parts of your mouth, tongue, etc., will start hurting. So this is a very debilitating thing for a patient. And once the mouth ulcer is there, keep looking at the mouth ulcer. And if it does not heal for more than 2 weeks, it is very important for you or imperative for you to go and visit your dentist. A chronic non-healing ulcer for more than 2 weeks, you should see a dentist. If there is too much of a pain, or if there is too much of a bad odor, or if there is a little swelling in that area, or some drastic color change in the ulcer, please make an appointment with your dentist and visit him and take his opinion. What causes mouth ulcers? There are many reasons why a mouth ulcer can happen. If I have to classify how the mouth ulcers are caused, number one is mechanical. What is a mechanical ulcer? A sharp tooth, whenever there is a sharp tooth, it can cause an ulcer. Whenever there is a denture in a patient and that denture is not fitting well and it poses more forces in certain areas, it causes an ulcer. Thirdly, braces. People can wear braces and these braces can lead to mouth ulcers. Secondly, it can also be medical. What is medical? Certain diseases. For example, chronic autoimmune diseases like Crohn's disease, inflammatory bowel syndrome, HIV, or celiac diseases. These are few major diseases which will predispose a patient to ulcers. Certain medicines also, for example, antibacterial like antibiotics, maybe NSAIDs, which are anti-inflammatory, long-term ingestion of these medicines along with some beta blockers are bound to give you mouth ulcers. Another important reason can be a bacterial or a viral infection can lead to mouth ulcers. Most importantly, the deficiencies, vitamin deficiencies, for example, vitamin B1, B3, B6, B12, most important B12, or vitamin D, or for example, these trace elements like zinc, magnesium. These all the things are required to maintain the healthy mucosa and the healthy skin. So these are the main causes for the deficiency part. And also, if you are a smoker, then if you don't sleep well, and certain hormones which are triggered during pregnancy or during the menstrual cycle of a female can lead to ulcers. So, the most important triggering factors for all these things are stress, anxiety, very important to have a peaceful mind and not be perturbed with the disease itself or with the external factors. Mouth ulcers, which are non healing and stay for a long time, more than 2 to 3 weeks, is definitely serious. It can cause a carcinoma or a cancer also. See, there are seven S's which are responsible, the causes of cancer. In that seven S, one S is sharp tooth. So, a sharp tooth which is constantly rubbing on an ulcer over a period of time, which doesn't heal, and which forms into a ulcer of proliferative growth, which is what I mean to say is like a cauliflower. If you have seen a cauliflower, if there's a small change in the texture of the ulcer and if it becomes more like a cauliflower texture, then that is a indication that it is going to turn or it is already turned into a cancer. So then you should definitely visit a dentist as early as possible and take the treatment for this.